The first device we're going to talk about for humidification is the Large Volume Nebuliser. You have already been using this with your cool aerosol mask, your trach collar, and your face tints. This is what we call a particulate humidifier, meaning it makes water particles. When you get this in the hospital, it'll come usually in a pre-package like this. Also, you can have water bottles by themselves. If you look on here, it says sterile water for inhalation. Make sure you get the water for inhalation because it is marked for inhalation. You do not wish to get sterile water that is used for any other device such as irrigation. It is for inhalation. So when you get this, as I said, this is a particulate humidifier. How it works is this hose will go into the water. As the gas travels across the top of the little hose here, it creates negative pressure, and then you'll get a capillary action of water coming up the hose. The jet of oxygen going across will then take the water drops and shatter them against a baffle that is inside here. So hence making millions of tiny little water droplets. What you need to remember is this is a particulate humidifier. If any secretions or any bacteria or anything get down in this bottle, it will be sucked up into here and then it will be delivered to your patient. That is important. These bottles right here, you run until empty, which they'll probably last about 8 hours. The entire system, change it per hospital recommendations. Typically, you need to change them every 24 hours, the entire system. But go with what your hospital says. When this comes, typically it'll come in a package like this. It'll come in one big bag. You'll have a cap that is sealed on here. You have to twist it. You'll break the plastic. There's a plastic ring. You'll hear crack, crack, crack. Unscrew it, open it up. This will be in another package. You rip the paper open. It'll be laying there. You pick it up by the collar and put it in. You see, I did not touch the hose. You then screw this in and make it tight. There is an aluminum collar right here. There were some things that we used to use called heated donuts. Some places may still have them, and it'll sit right there to try to increase the temperature of the gas, thus to increase the humidification. Now, you have been playing with this with the FiO2, that is the percentage. If you hook it up to air, the air flow meter, yellow is air, you will be delivering 21% regardless of how you set this. Because if you power it with air and entrain air, you're going to give air. What this will do is determine how much humidity, sort of how much humidity you give due to how much air you're entraining. So this will also affect your total flow. Do you still need to do your magic box? Yes, to make sure you get the appropriate total flow. You may be doing this for someone who just needs cool aerosol, such as trach collars, or for whatever reason, if they just need cool aerosol to help soothe the throat. As you already know, if you hook it up to the oxygen flow meter, that is when the FiO2 comes into play and you can actually deliver the true FiO2 as ordered. If it is just a room air cool aerosol, this only goes down to 28%, so you will have to hook it up to air, and then you'd be delivering 21% regardless of this, just the total flow, the noise, and how much humidity you give. This is the Large Volume Nebuliser. It is designed to deliver humidification. It delivers particulate humidification and gets changed. Bottles get changed when empty about every 8 hours. The entire system should get changed about every 24 hours for infection control. And it is, as I said, particulate humidifier. If the water gets contaminated, it will suck it up and can deliver any contaminants to your patient. It is used with cool aerosol mask, trach collar, face tint, and at times, or used to be used with the oxy hood.